Good morning. This is Emily Poland. I'm the school nurse consultant for the Maine Department of Education. And today I'm just going to walk through the standard operating procedure as I understand it today, August 26th, 2021. And hopefully this will be able to answer some questions that have been coming up about how we're going to be handling positive COVID cases in school. So let me just get started here. So why do we even have the standard operating procedure? I think that we all know this, but let me just do a reminder that in the standard operating procedure, there are different sections. This is the background, purpose, and rationale. And the SOP really provides a framework for us to respond to COVID-19 cases in our schools. And that's teachers, other staff, students. And we want to be able to control the spread, identify outbreaks quickly, or even identify cases quickly, and hopefully prevent the spread and help prevent future outbreaks. So that's kind of the purpose of why we do this. And the methods section kind of goes through what Maine CDC follows for case definition and how a case starts being investigated. The first thing that happens is when that a case would be approaching is when a school finds out about a case, and that's through a parent notification, through a doctor's notification. Whenever the school learns of a case of COVID, they have the responsibility of reporting that to the state, and that is done for COVID-19. It is done through the reporting form for DOE or through the hotline. We really prefer that you use that reporting form that's online. It is the quickest and most streamlined way to report that case. All right, let's get my slides advanced here. There we go. So what are the school responsibilities with a COVID case? We know that schools play a big part in responding to COVID cases in our schools. And so one of the things that is the first school responsibility is notifying your school community that you are following the standard operating procedure. You can do that even before you're responding to a positive case. You were going to tell them, we're following this case. We're going to be notifying close contacts that they need to quarantine. You're going to notify all of your school population that they will be enrolled into the Sarah Alert program. This is a change from last year, so everyone will be enrolled. There's an expectation that they understand why, and that's kind of the school responsibility, is to notify your community that Sarah Alert is a way to monitor for symptoms for those who are close contacts. Now, please understand that at any time once they're uploaded into the Sarah Alert system, they can opt out at any time, and our DOE contact tracers are prepared to talk through that with families. This was a way to make it more streamlined. So that's for Sarah Alert. We want you to notify your school communities of that. And the next thing you're going to have to do is notify a case, right? So the notification of a case, and that is through the reporting form, as I mentioned already, or the hotline. Now, the purpose of reporting that case through the DOE form is that schools generally have a lot of information about infectious diseases in general, but about the cases that can get the investigation going faster than if we were to wait for the lab, the report to come through the lab. We want the school to have a designated point of contact for Maine CDC for the case investigators. So when you are reporting that form, make sure you indicate who is the best point of contact and what's the best phone number to reach you. It's good to have 2 phone numbers for after hours. So if you're only in the school building from 8 until 3:30, that they have a way to reach you after 3:30. And the last thing is that the nurse, there are a lot of different school roles, but the nurse is really the best person to communicate with the case itself. So the person who is sick or is the positive case, they might be asymptomatic, but that is the nurse's role, is to really educate the family on proper isolation at home, how to monitor for symptoms, when to decide to go seek further medical care if needed. All of the other roles, notifying close contacts, communicating with families about quarantine, that can all be done by other school staff. All right, so this kind of breaks down what the role of the school is into 4 steps. You're calling, that's the notifying of a positive case. You're identifying those close contacts. You're informing those close contacts that they've had exposure and recommending their testing and quarantine as appropriate. And we'll get to that in a few minutes. And then the last thing is to submit that close contact list using the template that our contact tracing team uses. And that's done via an XLS format or a Google Sheet. And that is done through email. Now we're moving into the laboratory testing section, and I want to note that any antigen or PCR test done within a facility or a clinic will open an investigation. The CDC will not investigate at-home tests. If you receive an at-home test, if a family tells you that they tested positive with an at-home test, refer them to a testing site, or if you're able, go ahead and test them at the school if you have capacity to do that. That's the only way they're going to have a case opened, and the only way we can officially put people in quarantine who are close contacts. A PCR confirmation is not required for antigen tests, but I do want to just note that an outbreak will not be opened until there are 3 PCR confirmed tests in 14 days. So for your operationally, you could request the first few cases that you're seeing get PCR confirmation, but otherwise it's not necessary. So there's different testing options for schools, and I'm not going to go through the testing options here because the purpose is to go through standard operating procedure, but just very briefly, we have pooled testing and we have the Binex now antigen testing. Now, pooled testing, both of these things can be of great benefit to a school. Again, I'm not going to go through all of the details about testing. That's left for another day. Now, isolation, this is the term we use for someone who is the positive case. The positive case must isolate until they meet criteria for release. So the criteria here are at least 10 days have passed since your symptom onset or your positive test, whichever was earliest. So, and then you have to have had no fever for at least 1 day, and all of your other symptoms are improved. They don't have to be completely gone, but you need to be improving. If you're not feeling well enough to make it through a whole day, then you're not well enough to be at school or work. So if you never had any symptoms, it would be at least 10 days have passed since your first positive test, and you continue to have no symptoms. So quarantine is what we use for those close contacts, right? So the close contacts, any close contact, regardless if they have to quarantine or not, should be notified of their exposure. So I say that because even those that are vaccinated, those are the ones, people that are vaccinated do not need to quarantine, but they should be notified of that exposure so that they can be monitoring themselves for symptoms and even getting tested at this point for vaccinated people. The definition of a close contact is within 6 feet of a person for 15 minutes or more during their infectious period of COVID-19, or direct physical contact. And I don't have that written here, but we need to always remember that direct physical contact, hugging, kissing, playing sports where there's physical contact, that's direct physical contact. And there is no time for that. So it's any direct physical contact would make you a close contact. All right, so this is the tricky part, right? So that's the exceptions to quarantine. There are 4 exceptions to quarantine. Now, this is section F of the SOP on page 5. And I want to make sure everyone understands this. This is an exception to quarantine. It is not an exception to being a close contact. So these people are close contacts, but they have exceptions to quarantine. So they don't have to quarantine. They have the exposure, but they don't have to, they have some ways to get out of quarantine. So the 4 different options are being fully vaccinated. Being fully vaccinated, that's the gold standard, right? That's what we want everybody to be. Anyone that is fully vaccinated who is a close contact does not need to quarantine, does not need to quarantine from the community, does not need to quarantine from school. They should recommended that they get tested 3 to 5 days after they have been exposed, and that they wear a mask while they're waiting for that test. They do not need to quarantine while they're waiting for that test. They can continue about their day. The second option is those people who are within that 90-day period if they had a previous positive COVID-19 result. Now, if they had thought they had COVID but were never tested, that doesn't count. They need to have they need to have had a laboratory test that said they had COVID-19 within the past 90 days. Again, that gets them out of quarantine. No quarantine from school, no quarantine from community, anything. The third one is that you have pooled testing going on in your school. If you don't have pooled testing in your school, then this won't apply to your school at all, so you can ignore it. But if you have pooled testing and it is a school exposure, then there is an exception to quarantine. The fourth option is a school that has a mandatory masking policy. We're calling this a universal mandatory masking policy. And that student was at least 3 feet away and there was no direct physical contact occurring. And that is only for classroom exposures. So I think I'm going to go through those a little bit more, yes, here in this chart, to go through all of those again to kind of explain this table. Table 2, and this is on page 7 of your SOP. Table 2, it gives you the quarantine details. So someone who is vaccinated, this is exception number 1. They do not need to quarantine. They do not need to quarantine from school. They do not need to quarantine from school-related activities, and they can just be notified of their exposure. That's what that means. The school notification, they are just notified. So email, phone call, whatever you're doing for notification of your close contacts. Exception number 2 is that 90 days. So if they've been in 90 days, past 90 days, they've been a COVID positive person. No community quarantine, no classroom quarantine, no quarantine from school related activities and sports. And again, they should just be notified of their exposure. Pooled testing. So if your school is doing pooled testing and this close contact is participating in the pooled testing, then they only need to quarantine from community. So they can continue to go to school. That's the second column there, classroom quarantine. They can continue to go to school. They do not need to quarantine from school. They do not need to quarantine from after school sports or after school activities. They can continue those, and they need to be notified. They will not go on your contact tracing list. They will not be uploaded into SARA alert. So that is your pooled testing. If your pooled testing person is exposed from a community event, like at home through a family event, this exception does not apply to them. This is only for exposures that happen at school. So a school-related exposure. Now, a school-related exposure can be during football practice, for example. So that exposure would fall under this exception, and you would be able to continue. And all of the people that are enrolled in pooled testing would be able to continue to go to school. Those that are not enrolled in pooled testing would have to quarantine for the full time. They would not be able to test out of that quarantine, and they cannot come to school. Exception number 4 This only applies for schools that have the universal masking policy, and this is for classroom exposures only. For the community, that student would have to quarantine from community. The universal masking allows the student who is within between that 3 to 6 feet of the positive case to continue to go to the class, go to school. They don't have to quarantine from the school day. They do need to quarantine from after school activities and anything going on in the community. So their only thing that they can do is come to school and go home. Now that is a school with a universal masking policy, and that exposure was at least 3 feet away. So you're really talking about these 3 to 6 feet from the positive case, because if it was greater than 6 feet, they wouldn't be a close contact, right? Okay. Now you can see that the staff on here, that it says that they do have to quarantine. This does not, so they're not giving this exception to staff. And let me just walk through the options for staff at this point. Staff can be fully vaccinated. There's all of our staff are eligible for vaccine right now. Vaccination would get them out of quarantine, any exposure. They can also be part of your pooled testing program, which also would allow them to continue to come to school. Or if your school has the ability, you can do daily serial testing of your staff with using the Binax Now test. And if a staff person tests negative and they're asymptomatic, they can continue to go to work and school, go to work at school. Then you have the person who has no exceptions, and then they have to quarantine, right? So that would be no exceptions, no pooled testing, no masking, no none of those other measures. So they would have to quarantine from all activities, school and community. On that last column, you'll note that where it says letter and Sarah alert, these are the people that are going to be on your contact tracing template. So when you send in your list of close contacts, you're going to include all of those students and staff that, even if they fit under exception number 4, you're going to put them on that close contact list, and then all of the people with no exception. You will not put people who are vaccinated or post in their 90-day period. You will not put those people on your contact tracing template. All right, so we're moving into our contact tracing. What you're going to do is first identify all of the close contacts. Don't think about the exceptions at first. Identify your close contacts just as you did before. You're going to be identifying close contacts in the classroom. You're going to identify close contacts in the cafeteria. In the cafeteria, it's those within 6 feet for 15 minutes or more. On the bus, it's those within 6 feet for 15 minutes or more, or had direct physical contact. Direct physical contact always applies, even in the cafeteria. I didn't say it for the first time. Then you have to remember outside recess, after school activities, and we're using that same definition, those within 6 feet for 15 minutes or direct physical contact for all settings. So in all of those settings, the more you can know about where people are, the better. So especially, on the bus, assigned seating is really going to help, because if you don't know where people were sitting, you're going to have to identify everybody as a close contact. Cafeteria, same thing. You need to know where people are sitting. After you've identified all those close contacts, that's when you go through and wean out those who have an exception, those who have had a positive test within 90 days, those that are vaccinated. And then the pooled testing, same thing. If you're doing pooled testing, pull those out. Although it adds some layers of work, it does meet the goal of trying to keep our kids in school as much as possible. So we're giving, options for for keeping kids in school. The contact tracing template that comes via email after the confirmation of a positive case. So when you submit a case through our case reporting form, you'll get an automatic email that comes back to you and says, we received your report. If you don't automatically receive that email, there may have been a typo in your email address. So that seems to be the only time we've had problems is when there's a typo. And the template will come with a confirmation from CDC when you get that confirmation number, but you don't have to wait for that a confirmation to start your contact tracing. You can download the contact tracing template from the COVID-19 toolkit on the DOE website. There is a quick link on the right-hand side with all the buttons. So you have to scroll down a bit, but there is a button there with the contact tracing template. If you have any questions during your process of contact tracing, I'd ask you to please call the hotline that is staffed with nurses from 8 a.m. to 5 p.m. Monday through Friday at this point in time. Or you can call the CDC with general questions, and that's 1-800-821-5821. So just with notification and communication, we're going to move along into the SOP. And so I'm kind of skipping all of those tables that are in your SOP. Just from the Maine CDC side, when a case investigator learns of a case and they'll notify the school. They must notify the school if this case was physically in attendance during that person's infectious period. So that's like their requirement. And then the recommendation, the encouragement is for case investigators to inform the school if they were in attendance during their exposure period. So the infectious period is that 2 days prior to either test or symptom onset. And the exposure period is actually 2 weeks before. So that's where they could have been exposed to COVID. And schools will report using the case reporting form, as I've said. There are a lot of communication samples in the appendix. And that's the end of the SOP review. All right, so I'm going to go back to this table because I want to look at some questions that we have been getting. So one of the questions that we're getting is about the masking. So if the school is masking, that means that no one has to quarantine, correct? That's not correct. You will have to quarantine from the class, from community and after school activities. The universal masking policy really gets kids into school for the school day. And remember, if that exposure was closer than 3 feet, the masking isn't going to be an option for you. If you have exposure from the cafeteria or from recess or from football, and all you're using as all you have is masking as your safety net, those people are still going to have to quarantine from school if the exposure happened outside of the classroom. The classroom is more of a controlled environment. We know what's going on in the classroom generally. So on the close contact tracing list, remember when you're filling out that contact tracing template, the only people that go on that list are those that have no exception to quarantine or only have the exception from masking. So if the exception is that they don't have to quarantine because of the universal masking policy, and that's just from the school day, put them on the contact tracing template. Those people will go on that contact tracing template. think that, okay, I have a couple more things about details about a community and sports as far as contact tracing. We know that there are a lot of community programs, so rec programs, that are closely linked with the school. We've gotten questions about whether or not we can treat them like a school program, and the answer is no. So the pooled testing participants, they can participate in after-school programs if that close contact was from a school exposure. If that exposure happened during a community sporting event, that exception does not apply. They would need to quarantine from school and all school activities. The other, now I just lost my train. The other piece relating to sports, we know that many sporting, you're going to be having interscholastic, right? So one school plays against another school. I'd ask that those situations, if the school with the positive case would please communicate to the other school. You don't tell them who the positive case was. They don't need to know that, but they do need to know some sort of case identifier, so that on the contact tracing side for our SARA alert process, we can link those exposures together. So when you have say you have a soccer player from I'm trying to make up a high school and I can't think of one. So you have a student from ABC High School, and ABC High School has a soccer player that tests positive, and they just played a game against XYZ. XYZ needs to know about that positive case, if that was during their infectious period, if the game was during their infectious period, and XYZ needs to send in their close contact list to the contact tracing team. On that contact tracing template, please use the same case identifier as ABC did. And you can say that that exposure location was ABC soccer game. So use the same identifier if that's the case initials or the NBS number. Somehow identify this ABC soccer player on the close contact template for XYZ when you submit your list. It connects the exposures. It allows us to follow them and to see where, if one of those exposures ends up having symptoms and becoming a case, it connects that. And I think that is all I have for today. I hope that this has answered some of your questions and that we have enough resources to support you during this school year. We know it's going to be challenging. We have to be able to respond and be nimble and keep keeping on. So I would ask that you please call the hotline if you have questions. That is going to be the best way to connect you with the people you need. And hopefully we'll also get you introduced to your school public health response team very soon, and there will be additional supports for you. So thank you for taking time to watch this, and I hope that it was helpful.